Welcome to Gestamos, a Colombian company in which you can find the best specialists and equipment for your requirements.
We are located in Ibgué, Tolima, most specifically at Javerianos Medical Center.
Besides different obstetrical services, surrogacy is one of the most important and advanced procedures that Gestamos offers. Our medical center is completely equipped with technological, personal, and scientific means to attend every necessity of each step of the process.
The team offers expert guidance and support to every single customer for them to be sure and safe about the process of bringing to life a new baby.
According to ruling T968 of 2009 of the Colombian Constitutional Court, surrogate motherhood is the reproductive act that generates the birth of a gested child by a woman subject to an agreement or commitment. Surrogacy is a high-level biomedical procedure of assisted human reproduction that can be performed by different means, all of them available in our laboratory.
Everything starts with a medical consultation between our main doctor, Juan Carlos Rodriguez, and the intentional parent. Here we carry out a detailed explanation of all the medical treatment. Also, is the right moment to solve any questions about the process that is about to begin.
During all the procedure, Gestamos has the most professional psychological accompaniment for intentional parents. Here, parents will have a complete guidance for them to be sure and safe in each step of bringing to life the new child. In this appointment, intentional parents can also determine the specific characteristics wanted for the baby, like height, skin color, eye color, among others. When this is established, we search for a donor that matches with the wished phenotype, and the sample then is taken for the next step in the lab.
In the embryology lab, we have all the equipment to choose the correct spermatozoa. For this, we make a spermiogram to determine the characteristics of each one of them and select the ones that are suitable for the procedure.
After selecting the sample, this one traverses through a MAC, magnetic activated cell sorting, that acts as a magnet to attract the spermatozoons that does not fit with the requirements. The ones that complete the journey are the competent to proceed with in vitro fertilization. The ovule is selected by the biologist after a detailed analysis. The one with the right characteristics according to shape and size is selected to begin with in vitro. Also, if the patient wants a specific gender for the baby, a PGTA will be done. This pre-implantation genetic study evaluates the embryo and looks for any important illness. As well, it determines the gender of the embryo so that we can select the one that suits better with the requirements asked by the patient. We use 1 or 2 embryos for the process. The rest of the embryos are frozen. Gestamos has one of the most advanced and complete gamete banks in the country. In here, we keep by cryopreservation the cells, ovules, sperm, and gametes that can be used with the future parents in surrogacy. Also, in the embryo bank, intentional parents can preserve the embryos that were not used for the pregnancy of the surrogate mother. After choosing the adequate sperm and eggs or having the ones from the parents, comes the assignment of the surrogate mother. Gestamos mediates the gestation process between the surrogate and the parents. Also, Gestamos is in charge of selecting a healthy woman who has completed a series of requirements. The patient chooses whether or not she wants video calls to meet the surrogate mother and begin the pregnancy by virtual means. Then comes all the first step of life in the laboratory. Everything is made by in vitro fertilization, which is the most effective form of assisted reproductive technology. In this treatment, we let a previously selected spermatozoon fertilize the egg naturally in an optimal and adequate environment in our laboratory. Then it is transferred to an incubator that simulates the conditions of an uterus. Later, it is resettled to the womb of the pregnant woman within the following 3 or 5 days in the blastocyst state. ICSI in vitro fertilization is the most advanced procedure that we use at Gestamos. It consists in the introduction of the sperm in the ovule by an intracytoplasmatic injection performed with the micromanipulator in the IVF laboratory. Once this procedure is done, it is transferred to the pregnant woman under the same conditions as in vitro fertilization. Both techniques are available at Gestamos Reproductive Medicine Unit. It is important to keep in mind that the surrogate mother is not genetically related to the embryo. Once the pregnancy is confirmed after all the lab processes and checking through ultrasound, the prenatal stage begins. This is the image area, where we have all the ultrasound devices and scans equipped with the last technology to do the monthly view of the baby with the most professional and detailed machines. This equipment also allows genetic screening, detailed anatomy ultrasound, and obstetric Doppler. During pregnancy, we offer all the structure to attend each necessity of the surrogate gestation, all included in the prenatal package. Everything is strictly planned to be sure that the baby is safe and in the best conditions until the delivery day. The which day arrives, and depending on the conditions of the surrogate mother, a natural birth or a cesarean will be assisted by our specialists for then making the delivery of the newborn to the intentional parent. Gestamos mediates all the legal process, which has the following stages. Teleconsultation with the legal area to get information that includes where the contract will be signed by the surrogate mother and the legal representative of Gestamos with the respective notary authentication. Monthly payment to the pregnant woman that guarantees her maintenance and transfers to the controls in stations. EPS and life policy for the surrogate mother. Legal process and civil registration of the newborn. Process of recognition of the baby at 4 months of gestation. Management of the baby's passport in case of foreign parent. Gestamos makes the accompaniment in all the medical processes, that includes gamete banks and in vitro fertilizations. Besides this, psychological, legal, and financial means are also guided by a specialized team. Surrogate gestation is aimed to help LGBTI community, women with recurrent pregnancy loss or without uterus, and single men. You're all welcome.
Unidad de Medicina Reproductiva. Nace una esperanza. Nace una vida.